Hey everybody, this is Dr. Dhoon from Greeley Dental Care. If you've been in a denture or without teeth for a very long period of time, when you bite into a tooth, the tooth vibrates in the bone. When it vibrates in the bone, it stimulates the bone cells to stay present. When you pull a tooth, there's no exercise to the bone, there's no vibration, the bone cells will shrink. So when the bone cells shrink, they atrophy and they go away. If you wear a denture on top of the bone, or just as a tooth replacement option, the denture will actually speed up the rate of bone loss. So a lot of patients who've been in dentures for over 10 years, they come in and there's zero bone left. Now this is my scan, so thankfully I have some teeth here, but imagine this where there's zero bone present. And this is why people are told in other offices that you don't have enough bone because conventionally we're only placing implants here. Now what we can do is we have a procedure called a block graft where we can regrow the bone for you, and we regrow it over here. Other times we have zygomatic implants, and with zygomatic implants, everybody has zygomatic bone, right? The vast majority of people who haven't had like facial reconstructive surgeries or trauma have zygomatic bone, which means that almost everybody nowadays is a candidate for implants. Unless you have head or neck radiation, unless you're on bisphosphonates, you are a candidate for implants. So I encourage you guys to come in, get one of these complimentary 3D scans done, because we're going to go ahead and see if you're a candidate. And like I said before, 99 out of 100 times, I'm telling you, you're a good candidate for this. These are the 3D scans that we have. Back when I first started doing these procedures, we'd run off a 2D scan. Now we look at things from all different angles. We make sure there's no pathology. We make sure there's nothing going on from a dental perspective only. And we're going to make sure you're a good candidate for implants. And the cool thing with this is I can 3D print this model out. I can do your surgery ahead of time. Before you ever walk into the practice, I've already done everything. I already know how to handle the surgery. There's no surprises for us anymore. The team already has done this and test run this for you. So you walk in, and this is why we're so efficient these days, is because of the 3D scanning, because of the iMetric 4D scanning of the implants, because of the 3D printers we have in-house and the in-house ceramist and the in-house lab technician. All of this has allowed us to give you guys the best product possible and do it as painlessly as possible, as quickly as possible. And the temporaries we're putting, and this is the cool part, the temporaries we're putting out these days are better than the finals I was doing 5 years ago. But one thing I do know well is dentistry. I speak it very fluently, and the rest of the team, they know all this stuff as well too. So we look forward to meeting you.